Hello everybody and welcome to my next video. This topic that I'm going to talk about today is a little bit more serious. And the question that I'm going to try to answer today is, what is possible when we look beyond the autism diagnosis? As many of you already know, I have worked for nearly 15 years with autistic children. They came to me randomly at the beginning where I didn't know anything about autism. And in the meantime, fast forward, I even did my doctorate and PhD degree on autism, especially on nonverbal autistic children. And I have seen amazing results with the protocol I developed. This protocol is called quantum homeopathy with kinesiology approach. What does this entail? It entails homeopathy, as you hear already in the name or the title of the protocol, but it also entails kinesiology testing. So this is quite different from other functional doctors' protocols or whatever they apply when they work with autistic children, because I use very much my intuitional intelligence, which is my strength. I found it out by myself. By the way, this is another modality I have developed recently, where I can find out the strengths of everyone's, even adults, for everyone, children, adults, what is their genius, or where can they become a genius on a specific type of intelligence forms. So this was just a little side back. But back to my highest form of intelligence, which lies in intuition. From a very young girl I have been perceived things that I couldn't explain, or that other people didn't understand, and things became true. Yeah, I could see things. It doesn't mean that I'm a fortune teller or anything like that. No, I'm completely not. And I disagree with those things, absolutely. But when it comes to kinesiology, there is a science behind it. And I have written about it in my dissertation of my PhD, which means that when we do muscle testing, and by the way, we have so many medical doctors in Germany and dentists and other medical professionals. They use muscle testing to test out the right medication for their patients. This is not so much known or common in other countries, like in the UK, where I reside right now. But the science is very much kinesiology is very much science-backed, because it works with the muscles. But I developed an advanced method of kinesiology, which means I'm able to test on my own muscles. I can test for other people in a distance. I'm not really testing anyone in the distance. I'm using myself, my own body, my muscles, and concentrate on a picture of my patient and do the testing on me, but with the intention to find out what's wrong with my patient. And I didn't really believe at the beginning that I could do it, that I could do this. But my own patients, who were physicists and they had some knowledge of quantum physics, they encouraged me actually to test their autistic child in the distance. This was many, many years ago, before I even did my PhD. And I told them, I'm sure I can do it, because whenever my children are on holidays and they need my help, I can quickly pinpoint what they need by testing out in a distance what they are suffering from and what homeopathic medicine they might need or any other treatment they might need. So I knew within myself I could do it, but I never applied it to my own patients. And the funny thing is, they convinced me. My own patients, the parents of a little autistic boy, convinced me, because they didn't want to come for 4 hours to me, to where I had my clinic from London. It was very far, so they used to come in person, and they said, no, we know you can send us the medicine by post. You don't have to see us in person. I said, okay, it's your, but I didn't do it right away. I called my mentor that time of my university. I studied quantum physics and integrative medicine, and I told her that. And she said, of course, Karina, you can do that. That time my name was Karina. Now my name is Dunya. Just for the people who are confused about my name change, okay? So that time she said, of course, you can do it. Because theoretically it's possible by the new knowledge. According to the new knowledge of quantum physics, we know that we are all connected within consciousness, which means that we can perceive certain things in a distance. And just imagine, sometimes some people, not all of them, they think of a person very strongly, and a minute later this person calls them. What does it mean? There is some of an energy, a telepathic ability, and many people have that. Not all of them. And some people are scared of it. And I was always curious about it, you know. And when I dig deeper into it, so I have to go back to that little boy before I continue telling you what my research brought up. It's amazing, because we have all the evidence of these things, of these paranormal insights that we can get. But this boy, I didn't know that time what was the problem. You know, we usually in homeopathy, we treat layer by layer by layer. So once we took off the uppermost layer, which we did a couple of times with that boy over a couple of years, of course a new layer is presented, because in my opinion, and what we know already today, is that autism is an accumulation of many, many causes, many, many different layers. And we have to take off one layer at a time. Anyway, the parents didn't tell me what was the problem. I just thought, okay, let's do a next layer. I tested in a distance what this boy needs, and it came up panic, severe panic. That was the theme of his problem. And still the parents didn't explain to me what they think of it. They just said, send us the medicine. I sent out the medicine, and the protocol was 6 weeks long. And when the parents got back to me, they said, wow, that was amazing. I was a little bit, you know, like confused. And I said, okay, now you explain to me, what was the problem? And they said to me, you know, this little boy, of course, this boy is suffering from many, many different issues. So the parents didn't think just of one issue they wanted to get rid of. They wanted to treat multiple problems. But I found a specific problem which was related to panic. And then the parents told me, oh, this was so life-changing for us as a family, you know, this treatment they got for their son from me. The boy has totally changed in a sense of, I tell you what happened before the medicine. Whenever the parents went to a park for a walk, you know, for a little bit of leisure, enjoyment, and whenever there came a little bird or a pigeon or whatever, the boy started screaming like hell, really loud screaming. And everyone, of course, at the park were looking at the parents. They thought the parents hit the boy because he screamed like he was going to be killed. And so the parents tried or avoided going to the park or going to anywhere in public where there were birds. And after the treatment, the mom said to me, "You can't believe it. You can't believe it." I said, "Okay, go on, what happened?" She said, "Whenever we go out and there is a bird, a pigeon or whatever, they're already very anxious, the parents, what you can, of course, imagine. The boy isn't reacting anymore. He doesn't even notice the birds anymore." Wow, so that was the panic about. And they had no issues whatsoever with any flying things. And it was incredible, you see, and the parents didn't tell me before they started the medicine, before they even presented the case to me with a new layer. And from that moment on, I knew we are able, these days, we are able to test things in a distance that we don't know anything about. It is possible, and you can develop that skill if you practice enough. And if you have points of references, as I got from that specific family. So over the time, I had more points of references. I had more families who showed me that my testing was accurate. And it gave me more motivation. And so when now patients come on and they said to me, "Oh, you need to see my son in person," I said, "No, I don't. And I don't even... theoretically, I don't even need to see the patient. I don't even have to see a picture, but it is good for me because I want to concentrate on that person. I want to entangle with my patient." What does entanglement mean? You can read it up. Quantum physics has found out that we are all entangled with each other. And when we use that in medicine, that is exactly the opposite as Western medicine professionals are trained. They are trained to be objective, to look at the patients and their issues and their diagnosis from a state of objectivity, which is, of course, never possible because you are a subject and your patient is a subject. But in quantum physics, we use empathy, you know, we use the emotions and ability of being empathetic, compassionate, of being able to connect deeply with your patient. We use that to our advantage to get more insights on a different level, which with different senses. We don't only have our 5 senses, we have also our intuition. So that was a little thing I wanted to explain today. So you can, and I can really trust my testings because I have done thousands of them in the last years. So when I test the patient, what I recently also do, I don't only test the correct homeopathic remedy for the patient, I also test out, I put everything on the list, the different treatments they are there or that I offer in my clinic. And sometimes it's not 𝗪𝗂𝗁𝗂𝗃, it's maybe another protocol. I have some Indian colleagues who are amazing homeopaths and they developed certain protocols. So I will put all of the treatments that are available to me, that I can offer to my patients, I put it on a list with numbering, and I will test out what's the best treatment right now for that patient. And once I have done that, I will choose that treatment, and then we go deeper into what is it, what else does this child need? What body system is out of balance at the moment? And what's the homeopathic remedy or the homeopathic protocol? Sometimes we have 2, 3 different remedies at the same time. And usually we treat one layer, that's in my experience, takes 1 month. And then you see the layers off, the child changes. Some things can get worse, some things disappear. And the new things that get worse, they show up in the next uppermost layer. So for me, it's then my work to detect the uppermost layer, to give a new medicine, a new protocol for the next month, to wean off, melt down the next disease layer. That is how I work, and I can tell you from my research study with 8 non-verbal autistic little children, because parents ask me, you know, when new parents come to me, what have you seen? What are your experiences? I tell them, every child is different. I had really children, they had never said a word in their life, started talking after with 1 layer treatment that we treated. It was, I can still remember, it was a detox layer. We treated him with the remedy called polymetal with ascending potencies, 30C, 200C, first week 30C, second week 200C, third week 1M, which is 1000C, and the 4th week he was on 10,000C polymetal. So what we did a detox of heavy metals. And within those 4 weeks, he started to say, Mama, Baba. He said, family. He was noticing his relatives and called them by name. And he wasn't even prompted to do so. He did it by himself, just from his own interest in expressing himself. He started saying shower and water. It was amazing. So it is possible that autistic children get better and that they can start talking. They can start getting out of their bubble and see the world with different eyes, because the clutter in the brain, in the nervous system, will be taken away by homeopathy. And the next layer we did with this little boy, I still remember, was, I think it was an antibiotic I'm not sure, or was it? Oh no, it was a vaccine, polio vaccine. You did detox the childhood vaccines for another 4 weeks. That was the second layer. So I can tell you, when parents say to me, oh, is it mold that causes this autism problem in my child? Is it the vaccine? Is it, or maybe my pregnancy was difficult? You know what? I can tell you all of the causes I just mentioned, and many, many more are the cause of autism. And forget about the genetics. If this was caused by genetic factors, we would have many, many more autistic children 100 years ago. And I gave the evidence in my dissertation that the argument that we didn't have proper tools to diagnose autistic children 100 years ago, that is a scam. You know, why do I say that? Because I know I have friends who are teachers for 30 years. And if a teacher notices a difference, and she's not a medical professional, she never uses any tools, she just uses her observational skills. And if she tells me that there were no special needs apartments at her school or other schools that she knows, and they didn't have any problems with difficult behaviors 30 years ago, this tells me a lot. So I'm going to write a book about all my findings of my research and inform parents of what are the causes. And the question is, of course, can we reverse it? What can we do about all these causes? Yes, we can reverse it, but it takes time. It takes a belief also, not only my belief that your child can get better. It's a belief that you have to develop as a parent as well. Because what I can tell you, in my experience, the parents who were most convinced about a good outcome of the treatment were the most successful. And I have seen also the most desperate parents who really were eager to save their second child. Because sometimes we have parents, they have only autistic children. All of their children are all autistic. And when you have difficulties with an older child to reverse the autism diagnosis, and that's when where parents, they give up because they think that my child is too old, which is not true. It takes just longer to reverse. And I don't give you a guarantee that every child can become non-autistic. I'm not saying that, because we don't give any promises anyway. But yeah, I just share my experience. And when the second child was born, and the same problems happened, because they had already the evidence, the experience with their older child, you know, that, oh, this goes into the same direction. He didn't talk, he had a very difficult behavior, bumping his head on the floor, on the wall, biting, screaming, spinning, not being able to say anything. And when these same parents who didn't believe in the reversion of his first son believed, because they were so eager, said, please, doctor, they said to me, please, doctor, save our second child. We cannot allow this to happen. And because they were so motivated, I was motivated too. And we worked together, and he's now a normal child. And not even the teachers, he's now at secondary school, not even the teachers know about his previous autism diagnosis because the parents don't want to share it. They don't want to let anyone know about the label the little boy got when he was little. So there are so many things I could share, but I want to make it not too long today. Yeah. So to answer again the question, what is possible when we look beyond the autism diagnosis? There are many things you can do. You can change the diet of your child, which I highly, highly recommend. Highly recommend. I know it's difficult, but when you do it together with homeopathy, it's easier. Because when we start the homeopathic treatment, the child gets more appetite for healthy food. Or when we do the NAET treatment, it's also a treatment. It's an allergy elimination technique for autism. This has very, very good results. And that's, by the way, was one protocol I used for that little boy that is not autistic anymore today. We used the 𝗪𝗵𝘁'𝗪 allergy elimination technique for him for many, many months. We did homeopathy, we did herbal remedies, very strong herbal remedies for the brain. And wow, before he started talking, he started singing. So the parents used that to teach their son words by letting him sing a song. And I still remember the last day they came to me. I said goodbye, the parents left to the car, and the boy stood in front of me in my door frame. He didn't want to leave. He looked into my eyes as he wanted to say thank you, but he could feel that he's not going to come back. And he was very little. He was just 3-4 years old. And I said to him, I'm not sharing his name now. It's confidential. But I said to him, I know you want to thank me, don't you? And I love you. And you're going to be good. And he didn't want to leave me. He looked into my eyes as he's never wanted to leave me again, because I gave him his life back. And then his father called him, come quickly, we want to go. And then he ran away, and I'm checking in. After a couple of years, I'm always checking in how is he? He's doing well. He's a normal child. So, yes, but the first thing I would recommend for parents who are looking for answers for their autistic child is try to build some trust within yourself that your child can get better. You have to really come to believe, and it takes time. And the best thing you can do, just start the treatment. And see for yourself, get some proof of evidence, get some points of reference. And when you get that, you build your trust in the treatment stronger, you build more belief in the healing of your child. So, autism is not the end diagnosis for your child. That's what I believe. And I have seen that this is true. So if you have any questions, if you like my video, please give it a thumb up. If you want to hear more about my work, subscribe to my channel, please, and share my information, share my video. So as I said, I'm writing the book right now. It has to come out soon. It might be even 2 parts because it's too much. It doesn't fit into one book. But yes, stay tuned, and I wish you all the best. All the details, how to contact me, are in the description. I wish you a beautiful day and see you soon. Bye bye.